Welcome back to the Concussion Teach Out. We're back here at NeuroSport. I'm here with Bara Alsalaheen. Bara, can you tell us a little bit about your role in concussion care and your role at NeuroSport?
Yes, absolutely. My name is Bara Alsalaheen. I am a physical therapist in NeuroSport, and my research program happens here in NeuroSport for the most part. I am mainly a vestibular physical therapist here, so I see a lot of patients who are referred for vestibular therapy after their concussion.
So tell us a little bit about what you mean by vestibular therapy. That word vestibular kind of scares people sometimes.
That's correct. So the vestibular system is a system that's inside the inner ear. It's mainly responsible for balance and eye-head coordination through multiple reflexes. So a lot of times after a concussion, when it's affected, people feel symptoms such as dizziness, lightheadedness, sensitivity to light and sound, and things of that nature. So yes, the word is scary, but it's a lot simpler than what it actually sounds.
And so when someone with a concussion has dizziness and they come to NeuroSport and the physicians decide that we want to have therapy for that dizziness, what sorts of things will you do with these patients?
Right, so first we will look at the specific things that need to be addressed within their vestibular system. We are able to look at their eye movement, the symmetry between eye movement and eye alignment. The second thing we look at is the coordination between their eye movement and head movement, and if that results in any symptoms such as dizziness and eye strain, most patients describe it. We look also at their ability to function in a complex environment. So a lot of our patients complain that they feel dizzy in crowded places, concert stadiums, big crowds, school hallways, when they're working. So we look at their ability to process complex visual environment, and then depending on the specific things that we find out, we give them exercises to work on these skill sets. A lot of the exercises are very simple. A lot of them involve different variations of eye movement and head movement. And then in later stages of the rehab, we incorporate as much sport-specific things or work-specific things as possible to make sure it's functional exercise for them.
That sounds like a lot of stuff for the patients to do. Are they able to follow your directions and actually do the things you want them to do?
Yes, absolutely. So we start with our patients depending on the level they're at. So if they're very dizzy, we start at very simple things. A lot of times it can be performed in seated positions or in standing positions. We also take into consideration the level they're at in terms of their age, their education level. So we try to make sure we explain our exercises in as plain of a language as possible, and it's very straightforward to follow. What we do also in the clinic, we actually demonstrate the exercises to the patient in the clinic and have them demonstrate the exercise back to us to make sure it's done correctly. We spend a lot of time with our patients making sure the exercise is done correctly so it can lead to the benefits that we're hoping it leads to.
And what do patients take away, or how do they feel about the therapy after they're actually involved in it?
A lot of the patients actually feel great after the therapy course is done. That's what a lot of our patients say. At the very beginning, we explain to them the idea behind the therapy because we feel like if they give the idea behind it, we have their buy-in. So we explain to them that throughout the course of this therapy, you will probably experience increase in your dizziness, lightheadedness, these types of symptoms. But this increase is transient. It should happen quickly and resolve quickly. And over time, this should go less and less and less until it eventually goes away. So we try to explain to them that the vestibular therapy exercises are no different than running. If you're on a treadmill and your heart rate is not up and you're not sweating, you're not really exercising. Same thing with the vestibular exercises. If you're not getting slightly dizzier and feeling the workout, you're not really exercising. And we emphasize the need that we need to make sure that this increase in symptoms is controlled. It's not increasing by too much, so it doesn't lead to prolonged symptoms per se.
Okay. And we've talked a lot about a lot of different symptoms that happen with concussion. So dizziness, would you think of it sort of as a special category of symptom in concussion, or is it just like one of all the symptoms we can think of it the same?
I think a lot of people refer to dizziness as one symptom on that symptom checklist you referred to, but we think of it as like a hub for many other things on that checklist. So a lot of our patients who experience dizziness experience some form of headache, some form of sensitivity to light and sound. Some of them experience nausea, balance problems, things of that nature. So when we look at the symptom inventory that we have, we see if there is dizziness and some of its associated symptoms. We tend to think this has something to do with the vestibular system. Especially in our younger patients, they may have a harder time explaining what dizziness is like, so we try to have a conversation about forgetting about the word dizziness. How can you describe what you're feeling? And we can from there move into the direction that we need to move to establish treatment.
And I think that's a really important point, because I think that's something that a lot of people don't understand, is that we think of dizziness as being dizzy, feeling imbalanced, feeling spinning, but the dizziness can actually cause a lot of the symptoms like headache.
Correct.
And so treating the dizziness not only gets rid of the dizziness, but can also get rid of other symptoms from concussion like headache and trouble with thinking.
You're absolutely right. So a lot of some of the research that we've done here and we've read also points to the fact that not only dizziness and other vestibular systems are very common, but they're also predictive of worse recovery after a concussion. So if someone is dizzy and they're not taking care of that component, that can affect their ability to read because they can't move their eyes well. It affects their ability to balance. It affects their ability to concentrate. So it tends to affect other areas of their function after concussion that they may not necessarily be able to link it back to dizziness. So we spend some time with our patients educating them about the importance of taking care of that aspect to other areas in life, such as academics and return to sport.
Yeah, and I think that's another important point, is the dizziness itself can actually cause problems with things that students and people who work as well and just use their eyes to read really can make their symptoms a lot worse. They might not connect it together. And I think as a vestibular therapist and a physician, we can kind of combine those two things and let them know that this hopefully is going to make that better.
Right. So a lot of our students in schools talk about things like feeling dizzy and winded in busy classes, in busy environments in the school, in the hallway, and the cafeteria. And they may not necessarily get dizzy, but they just feel overwhelmed with that. A lot of our adult patients who work, and as most people do now, spend a lot of time on the screen, they complain about their inability to process information as fast as they used to, and they may link back to some cognitive issues. But we also explain to them that it could be related to cognitive issues, but a big part of it could be related to your ability to see the information and process it from a visual standpoint.
So are you saying that people should avoid those screens when they have a concussion, or something different than that?
We're not necessarily telling them to avoid it. We're telling them to talk about controlled exposure. So at the very beginning, we're trying to limit the unnecessary screen exposure in the very first couple of days after their injury. But as they recondition themselves back to go back to school or work, we try to make sure it's controlled. So they do it at a level where it helps them get reintegrated back into their environment, but they don't do it for an extended period of time that it hampers their overall recovery process and timing.
So I think you touched on this a little bit, but is dizziness with concussion, is that something that if you see, that means you think people are going to get better faster from concussion, or if someone's got dizziness, might it mean that they're going to have a little more trouble with their concussion symptoms?
Right, so a lot of it, other than from the fact that it's very common, a lot of the research is pointing out to the fact that dizziness is predictive of worse recovery because it tends to affect all these other areas as well. Some of it could also be related to the fact that it's not addressed. So a lot of times if a patient sees a physician, for example, they focus more on the headache and some of the global recovery aspects of the concussion without addressing specific symptoms. And sometimes by not actively addressing dizziness and its associated impairments, it leads people to kind of worse recovery trajectory, if you may. So what we try to do is to intervene as soon as we're able to. A lot of times in the very early stages, even though the dizziness may recover on its own later for some patients, we like to be there on that first couple of days or weeks to provide some assurance and education that dizziness is something that is common, can be easily addressed, and it's not related to any long-term consequences after the injury.
Yeah, I agree. I think that one of the things that we see frequently at NeuroSport is that when people come in and they're having prolonged symptoms, one of the things they'll have still is dizziness. And although it seems like it should be relatively easy to recognize, I think sometimes it is hard for other physicians and maybe even patients to recognize that they have dizziness that needs treatment.
Right, you're absolutely right. I think part of it is with our patients, the lack of ability to explain what they feel in a language that their physician understand and their parents understand. We talk to our patients all the time that once you're able to explain and express yourself, it's easier for anybody around you to address and help you. At the same time, dizziness is one of those symptoms that is not easily to be expressed, especially for younger patients. And it's not easily recognizable. So for a lot of our concussion patients, their friends and families see them and they look fine. They don't have a cast on their arm or their legs, so they have a harder time expressing themselves. And And the concussion itself sometimes makes it harder to express what you're feeling and finding the right words for it. So we try to kind of do some detailed interviewing with our patients to really get to the bottom of what they're feeling and find different ways for them to express themselves.
Right. I think it's great. I think you're able to, and we're able to spend a little bit more time with the patients and actually spend the time to find out what's going on.
Right.
Unfortunately, in healthcare, that isn't always the case. Wanted to at least one more question. So when someone comes to a vestibular therapist, how many times would they see you?
So that's actually a very common question that we get from patients. We tell every patient that their case is unique and is different than any other case that we've seen. But on average, we see our patients for about 2 to 4 visits. Some people are recovered in as little as 1 visit, and some people need a lot more than that, depending on how many things they have to work on, depending on their compliance with the exercises, depending on their ability to come back to their appointments, and depending on what else is going on in terms of their overall concussion recovery beyond what we address in the vestibular therapy, such as issues related to headache, mood, neck issues, and other related aspects of their lives.
Yes, compliance is really important in this for dizziness with concussion. And so would you see them, you said 3 or 4 times, is that usually like 3 or 4 times in 1 week, or would it be stretched out?
It's usually stretched out. We see our patients on average for 1 visit a week. So when we see them for 3 visits, that will take roughly 3 weeks.
Great. Bara, thanks for joining us today.
Yeah, absolutely. Thank you for having me.
Thanks for joining us, and we look forward to seeing you in the next segment.